Greetings and welcome to this Truth to Power for You Safety Report Special, produced to provide you information that'll help you protect your family and yourself while also helping our nation to break the chains of deadly COVID-19 infection. We will discuss the risks of infection to you and your family, present tactics and strategies to help avoid being infected to COVID-19 that go beyond washing your hands and staying 6 feet away from people. We'll discuss the expectations of our government's ever-changing COVID-19 recommendations, and generally we'll give you a basic amount of information you can use to protect yourself and your family. Hi, I'm Brian Kasher, host of Truth to Power for You. I've owned and operated a hazmat training academy in Washington, D.C., managed a medical clinic reporting directly to leading-edge epidemiologists and occupational health physicians. I've designed anthrax cleanup training for emergency responders, provided personal protective equipment training and containment design training for the Pentagon, and provided oversight on behalf of the federal government at most federal agency headquarters, the White House, and Pentagon. I've earned an Emergency Preparedness Mesh certificate, several FEMA certificates, and am an authorized OSHA Standards Outreach Trainer. I have a Master's of Public Advocacy and numerous professional certifications, including the National Board of Certified Safety Professionals Certified Trainer status. Okay, I really need to start by getting some harmful information off the table. Government-issued misinformation has resulted in the people of the USA not understanding the serious nature of the global health crisis even today. Conflicting information has circulated deeply into our nation from federal, state, and local governments and some of the more fringe media outlets. This has resulted in people having vastly different ideas about what's the right thing to do, if anything. Millions of Americans were led to believe, hey, it's safe. The virus was under control. The USA has plenty of tests for anyone who needs one. This is just another Democratic impeachment. PPE is available to the medical community. It's okay to shake hands if you're in the business of politics. Whoa, no, no, no. None of this was correct, and it's not correct now. These types of messages endanger not only the people that get a false sense of security from them, but also the rest of us. Some of us, which will end up infected by the lackadaisical behaviors and beliefs of those misinformed by the government and faux news media outlets. Hey, they said it was all under control. I think it's fair to say most all of us know that was not true. This is resulting in the infection getting deeper and wider into our society. So, do you need to be protecting yourself beyond government recommendations? Let me start by saying, there are some of the world's leading experts in our government who have dedicated their entire lives to protecting the people of the United States. Many of our federal agencies like the Centers for Disease Control, National Institutes of Health, National Institute of Occupational Safety and Health, U.S. Public Health, and yes, even our military. But where the rubber hits the road, no matter what these hidden heroes do, they simply cannot stop you from being infected by this virus. The actions you yourself take will determine if you or your family are exposed or not. No local, state, or federal official can stop you from doing things that put yourself at risk of exposure and infection. Are government standards good enough to protect us from the virus? Well, you might have noticed government standards have changed a lot lately, and that they're getting stricter. Well, the truth is that the United States should have been implementing stricter standards 2 or 3 weeks, if not months ago. The standards we have today are not consistent, and many of these standards are still not the most protective measures available. In my experience, in our journey forward, we should not assume that at street level, these guidelines are by themselves effective. Why weren't stricter measures of today rolled out before when the virus was known to be so contagious in the first place? Because the cost of protecting human life is much more of a driver for government and business in the United States than the value of human life itself. It's true. There's been debates for decades about how do you place value on a human life. We know how much it costs business in terms of expenses. That's a big deal, right? You can do charts and graphs. What you can't do is on the other side of the equation, show how much is the value of my life or your life. And that's where things go downhill from there. Because what we end up focusing on is what is measurable, the cost, right? And people, they don't want to spend the money. In this case, we're getting bailouts. But the bailouts are in part necessary because of the lackadaisical approach taken by our government for the past months. There is no measurable value placed on human life. Sad but true. But there is measurable loss of revenue to business. This has been a bone of contention between big business and labor for decades. To emphasize the point, you can be sure the emergency operations centers around the United States have been following stricter, more protective guidelines than we've been recommended since the beginning. Right? They're screening who enters their command centers. Who told us to screen who comes in our homes? They're using high-efficiency particulate air scrubbers to catch any droplets that might get, brought into the center. Who told us to do that? And more. Even so, government standards and recommendations are generally intended to be minimum efforts, folks. But in life and business, these standards are often practiced as upper limit goals. In my experience, rarely are government standards voluntarily followed to the letter. Even if government standards are followed, they tend to be on the low end of the spectrum. They're not, the government standards, they don't want it to cost too much, folks. Let me give you an example. The purpose of the following video is to provide an example that has been in place for many years where the government is far from protecting a 100% protection factor, okay? This is not an asbestos crisis, but the asbestos standards give us such a beautiful illustration so you can better grasp whether or not government standards are going to protect you. Let's watch here.
So the OSHA permissible exposure limit is the legal limit at which an employee may be exposed to a contaminant, toxin, what have you, before the employer must provide that employee a respirator. There's been a long-standing policy in the United States that there is no safe level of exposure to cancer-causing agents. However, in 2017, the government decided to change that and is now exploring safe exposure limits to carcinogens. The permissible exposure limit for asbestos is 0.1 fibers per cubic centimeter of air. This is the legal limit that an employer may expose an employee prior to issuing a respirator. So, is 0.01 fibers per cc the safe level? Well, no, it's the legal, permissible level. So here's basically how it works. The average human breathes about 1 cubic meter of air per hour. Okay, 1 cubic meter of air equals 1 million cubic centimeters of air. So to figure this out, we're going to do a little bit of math, don't worry. But 1 million cubic centimeters of air over an 8-hour work shift would equal 8 million cubic centimeters of air, right? 8 hours. Okay, 8 million cubic centimeters of air times 0.1 fibers per cc equals 800,000 fibers permissibly inhaled during an 8-hour shift. And this is the federal government's standard for employee personnel exposure before a respirator is required. So the OSHA asbestos standard allows for significant exposures while minimizing the costs of doing business. Let's take a look at isolation as our single best protection from the emerging pandemic.
Isolation protects people who are not infected. Testing people identifies who has the virus so they can be moved away from those of us who are not infected. Other parts of the world have greatly reduced the rate of infection through isolation. But our best response measure, testing results, are still extremely limited today in the USA. We are hearing stories of people who have the symptoms and meet the criteria to be tested, but still have not been tested. For instance, in Robeson County, one of the poorest counties east of the Mississippi, here in North Carolina, as of 3/22/2020, has potentially infected people pay for a flu test, and if the flu test comes back negative, then they can get the free COVID-19 test. What? Right? So homeless people are supposed to pay for a flu test, have it come back negative, then they'll get the free COVID-19 test? Sorry. But that's just one example of a countless number of examples where the government is not operating on a consistent basis. Practices like this are leaving us all at risk of infection because people with the infection are not being identified. The infected poor who can't afford the flu test, they'll just fly under the radar, continuing to spread COVID-19 if they're not identified and dealt with. In the absence of a full testing program, we do not know most of who are infected or where the virus is spreading. This absence of data was used to promote the false sense of security that this was not so bad, that the use of the absence of data as being the same as negative is one of several tactics used to confuse people about the severity of the crisis. The USA does not have the data, and so people will keep infecting each other. Our nation is headed into this storm pretty much blinded by the absence of hard data. Since we're going into the storm blind, shouldn't we protect ourselves as much as possible? I mean, I myself prefer to err on the side of caution when life and health is at stake. It's been my career, 30 years, that's it. When life and health are at stake, you err on the side of caution and let the bean counters count beans. But that's not what we're witnessing today in the United States. Infected people are the hazard. Infected people are the hazard, and no one can tell you who has or who doesn't have the infection here in the United States. We have long surpassed the point where mixing in public, children playing together in the park, and going to the beach are safe for our nation and our families. We do not have medication that can stop the virus yet, so isolation is the single best way to avoid infection available to us. Isolation has proven effective to break the cycle of infection in other countries during this global pandemic. Oh, and contrary to many reports, children actually do get this virus and may be carriers with no symptoms at all. Further, adults have now been found to have the virus who have no symptoms whatsoever, okay? So don't think somebody's got to have a fever or coughing or something like that to be giving you the virus. They don't. My approach is to treat everybody outside of my family as infected, and I protect my family and myself accordingly. Know this, you have no way to know if the person you are talking to has the virus or not. You cannot assume that a neighbor's child or adult is virus-free without knowing everyone they've come in contact with is also virus-free. It is better to use an abundance of caution and protect yourself from anyone you don't know yourself is virus-free, which is you don't know. Your family you might, but anyone else, best practice, consider them infected and protect yourself accordingly. Know this, mixing in public, no matter what size of group, 150, 10, or even 2, puts you at risk of exposure. Protect yourself accordingly. Keep your distance and do not become a carrier who spreads the virus to your own family or friends. You could end up on life support. That is, if a ventilator is available. If you can keep away from other people, you vastly increase your chances of not being infected. I mean, really, folks, the hazard is people. Okay? It's not China. It's not, anything other than people. People are the carriers. If you are mixing with other people, to assume they are carriers is much safer than to assume they don't have the virus. All it takes is one exposure and you too can become a supercarrier, spreading the virus to your own family, friends, and not even know it, or worse, end up on life support. This does not mean no interaction with other people though, okay? But considering this virus spreads from person to person, you need to understand that it is people that are the source of infection to you, your family, and to me and my family. Minimizing interaction with people minimizes the potential for your being exposed and infected by the virus. It's often been my job to verify conformance to government standards on government sites and others for decades. Military sites, office buildings, scientific research centers, housing, industrial sites, hospitals, schools, and more. With almost every assignment, I've had to remind teams to follow the standards. And it's not just the teams doing the work, it's the teams paying for it too, folks. Know this, don't bet your life that people who claim to follow government standards are actually following them. People and organizations cut corners on government standards routinely. In business, cutting corners is a way of enhancing profit. Standards are not generally expected to eliminate health impacts from all exposures, but they're expected to reduce the number of impacts as a means to save operating expenses for business. Any fines are simply a cost of doing business, and company owners know fines are few and far apart. It is often simply cheaper to pay the fine than to follow the standard. Protect yourself. Don't expect because the sign says we follow CDC standards, one, that they're followed, or two, that they're protective anyway. Okay. Following a standard, as a minimum, will reduce your risk of infection, but not to zero. Going over and above minimum government standards will better protect you and your family from being exposed or infected. Know this, do not believe that following a government standard means you're 100% safe. Hand washing, for instance, is a good practice, and I certainly do it, and my kids too. But I also know that hand washing is not expected to eliminate all exposure to the virus or infections. So, if the government isn't really protecting you or me, and anyone could be a carrier spreading the infection, what do we do? Right? Well, for now, isolation of you and your family is the only sure way not to be exposed, and I do mean isolation. If you need to get out for food, fuel, or other supplies, you need to be sure you stay as far away from people as possible. You are not isolated in a store, in a line, or a hospital even, right? Just because people look great does not mean that they're not spreading the infection. Certainly, your children are not isolated playing up the street, right? Or at the playground with all those other friendly kids. 15 days away from people is the standard being used at this time to determine if you're a carrier. However, it is now understood that people can have the virus even with no symptoms. Just sharing a little bit of someone's exhaled breath could be enough to become infected. When you walk through a cloud of someone else's exhaled breath, sneeze, or cough, for instance, let's not forget it is allergy season. And with allergy season, we're going to have 1 billion sneezes a day in the United States. And somebody doesn't have to have a fever, a dry cough from the disease. Even if they don't have any COVID-19 symptoms, that sneeze still can infect you. And you could be exposed and come down with the virus, perhaps. You might also pick up infected droplets on your body or clothing. Understand that when it is cold and you see your breath, what you are seeing is actually the moisture. That's the droplets that is contaminated with the virus, okay? They contain the virus. It's those droplets in your exhaled air in that cloud that is understood to carry and spread COVID-19. Now, okay, right now, you can't see that breath coming out. If it was cold, you could see it. But even though it's not cold, that moisture is still coming out. I mean, the amount of moisture in exhaled breath is amazing. You'd be surprised. I mean, I've done the calculations before. You can get 55-gallon drums of moisture from the amount of air, the amount of moisture that comes out of people's breath in an average school day. It's amazing. Okay? So let's take a quick look at a video of what a sneeze looks like with special slow motion. And this was produced by the Massachusetts Institute of Technology.
Noting that it is allergy season, there's billions of sneezes a day in America. This is an extreme view of how the virus is transmitted. It's in our breath. You do not want to be in the path of anyone who sneezes at this point.
Okay, it should be pretty simple to understand that walking through a sneeze is a bad thing. But remember, the virus is microscopic. When the sneeze, cough, or exhaled breath cloud is no longer there, it doesn't mean that there's not microscopic droplets that are, they're gone. Well, just because you can't see it doesn't mean it's not there. Respirators, when used properly, are effective in stopping inhalation of the most, but not all, droplets. Okay? So with a respirator, you can stop, if the droplets hit this respirator, you can stop, it'll stop them. As long as it's on, right? As long as the respirator's on properly. But look, something like this, you bump it a little bit, it doesn't have a tight face-to-face piece seal, so it can get through there. Plus, with a mask like this, if you're walking through a cloud, you might not inhale those droplets, but it could get all over your face, on your clothes, and your hair. The bottom line is, if a respirator doesn't fit properly, if you don't know how to use it properly, if it's too old, it's not going to protect you at all, okay? Plus, respirators are in limited supply. If you want to use a respirator, or if you're using a respirator at work, the law requires you to be trained in how to use it. If you're using one to protect yourself anywhere other than work, you need to take some training. Learn how to use the respirator. Watch some videos, okay? We may do a follow-up video that gets into that level of training. We're not there with this one. But I will say, you need to know how to take it on, or how to put it on and take it off, because improper use, it just won't be of any value to you at all. In any case, if I'm going to rely on a respirator to protect me, first off, I'm not going to go somewhere that I need to wear one. But if I do, and it'll happen in my field, then I'm going to wear something like this. This has been my preferred respirator for a long, long time, okay? It has a tight face-to-face piece seal, okay? Nothing's getting through this. It's got HEPA filters on it, real filters, okay? It's got an exhale valve. This puppy, it's very protective. This not only is going to protect me from your exhaled breath, sorry to say it, but it's also going to protect me when you sneeze and those droplets get in the air, right? It's going to protect my eyes and the skin on my face from picking up those loose strands of virus that just happen to be floating around. So, it uses P100 filters. This is called a full face piece respirator. I don't have stock in these companies. I've been staying alive for quite a while using this type of equipment, and it's better off if you're in a position where you're going to need to use a respirator not to be in that situation, quite frankly. If you're trained for it, God bless you. Thank you for all you do. Thank you for helping the United States of America come through this thing. But if you're not trained in it, please don't think that you're getting 100% protection. No manufacturer claims it's going to protect you 100%, not one, okay? But if you have to use one, be sure you're trained in how to use it and its limitations. All respirators are not made the same, okay? Know this. If you're being put in a situation where you need to wear a respirator, you're not 100% protected by that respirator. Facial hair, inadequate face-to-face piece seal, leaks during inhalation, Or it could even just slip off for a few seconds right when you need it. Don't trust a respirator as being 100% effective. They're not. Okay. CDC emphasizes washing your hands and not touching your face, which are great practices. I support it. But in a pandemic where there's mass infection, I do whatever I can to prevent getting the virus on me to begin with, right? If hand washing was 100% effective, then emergency medical technicians, medical staff, and others would not be wearing gloves and face shields when in conditions that might potentially result in infection. Okay? Remember, folks, yes, our medical professionals need to be protected. They're on the front lines. But you know what? Now that we're in a pandemic and everybody's a potential source of this infection, we're all on the front lines. We're all on the front lines, okay? Okay? If I'm going out, right? If I've got to go in somewhere, I'm wearing gloves. Okay? If I have to touch surfaces in a location outside my home, okay, inside the home, I've been in isolation with my family. I know where they've been. I do. I know where they've been. I don't know where the neighbors' kids have been. I don't know where the neighbor's been. I don't know where the postman's been. I don't know where the food delivery person's been or the cook's been. What I know is where my family's been. Anybody else is a potential source of exposure, and no government person, none, can tell you who's contaminated with the virus, who's a carrier, who's infecting, and who's not. Okay? And I know I'm getting kind of preachy, but we're dealing with life and death here. Don't panic. But this is truly life and death, please. Okay? Don't think that washing your hands is 100% effective either, by the way. Okay? It is the cheapest way to get bang for the buck, which we know is what business wants, but it is not the most protective way for you to be protected. In general, of course, wash your hands regularly. But not getting the virus on your hands in the first place is much more effective and will keep you alive longer, okay? So for example, when you go out, everybody's going to have to go out at some point. When you go out and you grab a handle to dispense gas at the gas station, think about this. How do you know that the last person or two or three didn't sneeze into their hand, right? It's allergy season, before grabbing the dispenser? You don't. And it's a gamble. You grab that with your hand without a glove or without a paper towel or without a disinfectant wipe to protect you, there's a good chance you could be infected. Yeah, they're predicting a 60% potential infection of this country. 60%, right? So the time to gamble's done. It's gone. That was weeks ago. Now it's about 100% protection, 100% protection of yourself and your family, okay? You gotta wear gloves or at very least sanitize your hands immediately after use, something like that. Waiting a half hour or later to wash your hands at home can simply be too late. And the same idea, it applies to door handles, bus seats, park benches, and more. Everyone needs to understand how easy it is to be exposed, how to prevent yourself from being exposed, or the spread of infection is going to continue. Break the chains, folks. Protect yourself. Don't expect the news media to be able to do it. They can't. Whatever news media you love and cherish, they can't protect you. Your government officials, they can't protect you. It's up to you, and only you. You're the only one that can protect yourself and your family right now. Do it. Okay. Soon, when the hospitals can no longer serve us because there's no beds left and there's no more space at all, we might be expected to care for sick family members in our homes. At home, I'm not wearing gloves. Again, I know where my peeps been. I know where my children have been and my wife's been. I know where I've been. But I absolutely, if I'm going to be caring for a sick family member, or if they're caring for me if I end up getting sick, we're certainly going to protect ourselves in the area that family member is located, okay? I'm not saying isolate yourself from your children or isolate yourself from your significant other. What I'm saying is, as a family unit, protect yourselves, protect yourselves, protect yourselves. Consider any other human being a source of infection, right? Giggling around and sharing a drink or just, having fun, or there's so many ways I could describe infection potential. I think you're getting my point, and I'm sorry if it looks like I have an attitude, but I do. I'm trying to save people's lives where the government has kind of dropped the ball and is continuing to drop the ball in large part around our nation. Now, if somebody gets sick in my house, I'm going to wear gloves if I'm around them or in the room that they're in, but I'm also going to set up a form of containment with airflow out of the house from the room that the sick family member's in. So if they're in the bedroom, I'm going to have a fan on the window blowing air out so that the infection doesn't waft into the rest of the house, but goes outside. Okay? I'm also going to have HEPA filters, an air filtration unit in the room and things like that. That's beyond this training. This is very basic, first one out of the gate, but it might come to where people, tens of thousands of people, are being cared for at home, potentially exposing everyone in that home. We're very close to that now, and there's ways that you can protect yourself and live through that too. And you need to be thinking about these things because it's right around the corner, folks. It's right around the corners. But, containment design is beyond the scope of this awareness level training. But, and I pray that we don't get to the point where we need it. But next up, let's watch this short film and see just how fast and wide a contagion can be spread. there you have it. Oh my gosh, right? A little touch here, go over to the hand sanitizer and then contaminate that bottle, and then, oh, how about the drinking fountain or the door? I mean, it just spreads like wildfire. You need to be thinking like that, right? That little kid up the street, so cute, playing with your daughter. Who knows? That kid probably hasn't been anywhere, but you don't know where that kid's uncle, niece, nephew, mom, dad, classmate was 2 weeks ago. That's the problem. You don't know where they've been. You can't assume that they're free of the virus. Even if they're so happy and cute, they can still be spreading the virus. They can be super carriers, okay? So now let's take a look. You know, it might sound kind of silly, but let's take a look at how to put on, and more importantly, take off a glove. It's called donning and doffing.
Sam is entering her patient's room to perform a skin assessment. As part of standard precautions, Sam puts on gloves.
So,
When Sam comes back out, watch her actually touch the outside of a potentially infected glove.
Oops.
That's her error. That's potential infection.
Let's try that again, Sam. Sam performs hand hygiene and then puts on her gloves. Sam knows the outside of her gloves are contaminated. Using her gloved hand, she grasps the palm area of her other gloved hand and peels off the first glove, holding the removed glove in the gloved hand. She slides her fingers of her ungloved hand under the remaining glove at her wrist and peels off the second glove over the first glove. She discards the gloves in a waste container. Sam performs hand hygiene. That's more like it, Sam.
please, please be careful. Watch what you're doing. Take some training. Be looking at what's safe and what's not, okay? Now, why is testing so important? Testing tells us who's infected and who's not. Without this information, the virus can and is spreading unchecked throughout our nation. Without testing, we don't know where the infection clusters are or where its spread of the virus is. It's in our area. So, knowing who has the virus and who they've been in contact with gives us the ability to isolate infected people and break the infection cycle. So know this: there's no way for you to know if anyone around you is infected unless you've self-quarantined through the incubation period with them and know they've not been exposed since the quarantine. Mixing with people prevents infection risk to you, and it is a hazard. The USA now has governors stepping up, fighting profit-minded interests who want to stay open for business in the middle of a raging global pandemic. Some governors are mandating stay-home orders in our nation. This is not a Soviet-style controlled method as characterized by some of the fringe groups, but is a proven method to break the infection cycle. Other governors are more in tune with concern about commerce than concern for the human life of their state and are allowing open beaches and other obvious vectors for the spread of this virus. They're more concerned about profits and bringing money in than they are over what's good for their people, what's good for human health and life. That's just the way, I don't know how you can see it any other way. How is keeping a business open? I understand the need for business. I've been a businessman all my life. Okay, I've been a corporate, multinational corporate manager. I've owned my own corporations. I've done these things. I'm losing my butt on the stock market like everyone is. I understand that. Okay, but here's the thing. That's all The stuff, it's all fake. Money's fake. All the corporate, all those interests, it's all fake. It's not alive. Money's not life. And when people are making decisions right now rooted around money and commerce, that should be a crime against humanity, because what they're doing is ensuring that the disease is getting deeper and wider. This pandemic will be here longer, and we will have more pain in our country as a result. So understand, we as a people, we're very late in the testing game and are running into this storm blind, right? We're blind. Blind in that, we don't know who has it and who doesn't, and our government hasn't been doing the type of testing in the numbers that we need. The people they're testing are not even the entire group that needs to be tested to get this thing under control. I mean, this is really bad. But hey, don't panic. My point is not to instill panic. Be safe. Be with your family. Have a plan. Protect yourself and your loved ones. And know that most of us are going to survive. Most of us are going to survive. There's no question, right? All predictions are, even the worst models, there will still be Americans alive when this thing is over, okay? Most of us will be alive. But you know what? Those of us that take stricter precaution and use better protective measures will have better odds of not ending up infected, okay? So in review, use an abundance of caution and the most protective practices available to you. Isolation is the most protective condition available to the general public. Mixing in public, no matter what size a group, puts you at risk of exposure. Keep your distance from people. You have no way to know if the person you're talking to has the virus or not. Do not bet your life that people who claim to be people and businesses who claim to be following government standards are actually following them. Most of them haven't even read them. Do not think following a government standard means you're safe. It's a minimum. We may produce or follow up with a live stream to this introductory level program with more advanced topics, depending on how the government gears up its own guidance and communication, and also how this crisis unfolds. Topics like how to build a containment to protect your family from a sick family member, and others could be covered. If you have questions or comments, please post them below. We'll get back. Good sources of information are your local health department, state health department, especially the World Health Organization. And by the way, I have to say something. The World Health Organization's been getting bashed by quite a few of the faux and the fringe media outlets and some government officials. Let me tell you something. Their headquarters is about a 10-second walk from the United States State Department headquarters, okay? I had staff at and was at that headquarters for years. Drove by the WHO headquarters every day, okay? It's in Washington. They're not some secret, deep state group who are out to defraud the United States and kill our people. They're here to help us. Their tests got rolled out successfully in 60 countries. They're providing PPE to people all over the world. So please, not for a minute think that there's anything dastardly or wrong with the World Health Organization. They are there to help protect this world. And by the way, they're also here in the United States, right next to the State Department. Look it up on the map. Look up the U.S. State Department, and right to the north, across the street to the north, you'll find the World Health Organization. It's amazing. Good people, good group, nothing to be afraid of. Wish we could have got their test out, by the way. Anyway, be safe. Hard decisions and inconveniences now will give your family, your people, much higher odds of being together when this global pandemic has passed. This introductory awareness level session is not intended to be medical advice. If you're sick or believe you may have been infected by COVID-19, contact your doctor and local health department now. If you have a medical emergency right now, call 911. In closing, your voice matters. Please encourage all others not to fear, but to respect COVID-19 and take appropriate precautions. Until we have a vaccine, and medication to address COVID-19, the virus will continue to affect people and spread. Minimize your risks. Follow the safest precautions available to keep you and your family healthy, and understand that when tests are available, take one. When they become available to the general public, take one. Taking the test will help our nation fight COVID-19 by helping isolate the infected from healthy people. If you have no interest at all in protecting yourself, you're not afraid and all that good stuff, that's okay. But remember, as a carrier, you can infect others. Don't worry, okay, it's cool if you don't worry about yourself. I'm not pushing. But think about the children around you. Think about the emergency responders that might need to deal with you. Think about your family members and all the other people you're coming in contact with, okay? We need to be getting help out there to the least of these. People who cannot pay for flu tests to get the free COVID-19 tests. We've got to be coming up with plans on how to feed people over the coming weeks, how to get food to the elderly who can't leave their homes. We need to be safe when we do it, and we need to be developing plans now, and we're behind the 8 ball, folks. So be safe, protect yourself, protect your families, and we're going to come through this. We're going to, I want to see you on the other side. And my name's Brian Kasher. I approve this message, and my love for you is not defined by party politics, demographics, or finances. Be safe, and see you on the other side. Okay? So closing us out today is the wonderful Ann E. DeChant out of Nashville with her inspiring song, Out There.
People thought they were off their rockers. They'd never get that airplane off the ground. Till one morning out in Kitty Hawk in that Carolina sky, she flew 12 seconds before she came back down. Then people thought the sky was the limit, that going to the moon could not be done. But when the eagle landed, that brave space cowboy took one small step and proved everybody wrong. Out there, dancing on a wire, out there, running through the fire. They ain't afraid to fall, they live to risk it all. If you're gonna do a lot, then you gotta be a little out there. A seamstress from Montgomery, Alabama, stayed seated on a bus and took a stand. That brazen little move caused a revolution. She broke every boundary when she wouldn't budge an inch. So if you think that you won't make a difference, that what you're trying to prove is too bizarre, remember it's the dreamers, the do-or-die believers, that march right into history just being who they are. Out there, dancing on a wire, out there, running through the fire. They ain't afraid to fall, they live to risk it all. If you're gonna do a lot, then you gotta be a little out there. Busting down the fences, out there, damn the consequences. Let's live to risk it all, and don't be afraid to fall. If we're gonna do a lot, then we gotta be a little out there. People thought they were off their rocker.
Nice.
Thank you.